Well, 2023, it is right around the corner, and health is always a center focus of our New Year's resolutions, right? So why not focus on your heart? For today's Wellness Wednesday, we're going to take a closer look at how the American Heart Association is helping bring people more into their heart-healthy lives. This morning, we're joined by Kelly Curtis. She is the Chief Pharmacy Officer at St. Luke's. She's also a member of the American Heart Association. Hey, good morning, Kelly.
Good morning.
Thanks so much for getting up early and talking a little bit about this. It's so important. We'll just start off with the easy one here. American Heart Association, always helping people reduce the risk of heart disease and stroke. How are you guys doing that?
You know, we're doing a lot of wonderful work. It's been an amazing year in Idaho for Idaho residents as we try to work towards helping them live longer, healthier lives. We're working with the family medical residency and full circle health clinics. More than 26,000 patients are on their way to lowering their risk of heart disease and stroke through a self-monitoring blood pressure program. This last fiscal year, we also trained almost 45,000 students and community members in Idaho to save a life using hands-only CPR. Also wonderful work. This last fiscal year, almost 79,000 residents of Idaho were treated in hospitals that implement the American Heart Association's Get With The Guidelines programs, because we know when the right care is delivered at the right time, lives are saved. And then also this past year, we've had over 1,900 students participate in Idaho in the American Heart Association's school-based programs. And these school-based programs help students learn physical, social, and emotional skills that we hope will last them a lifetime. So lots of great work this past year. Also previously funded research at Boise State University to continue to help increase our knowledge around heart disease and stroke. So we've had a really great year.
Definitely, and starting off with, you know, kids early with the students and then later into college years, and that's going to, like you said, take them through life with those special skills. I mean, like CPR and stuff, that's invaluable. We've talked to some folks here who spoke to us, you know, firsthand about like lives saved and minutes just making all the difference there. What can people do in their own lives? Maybe it is signing up for some of those classes, but maybe changing some of their lifestyle as well, especially heading into the new year here. What can you suggest?
Absolutely. Just knowing your numbers is so important. Understanding your blood pressure, knowing your cholesterol, it's really important. I think it's also important to know for women that cardiovascular disease is the #1 killer, causing 1 in 3 deaths every year. But as we just said, the simple truth is that a lot of cardiovascular disease can be prevented with education and healthy lifestyle changes. But to learn more information, definitely visiting heart.org/Idaho. There's a lot more great information there.
Yeah, absolutely. And probably like simple changes, right? I mean, maybe getting out just a little bit more or making some small changes in diet. You know, can you speak to that a little bit? I mean, just this idea, I know it's cold, people don't want to go outside, but just maybe, you know, taking a walk around the block, that's got to add up eventually over time.
Absolutely. Those little changes, it is hard to take on a lot. It's certainly that new year, people take some lofty goals to try and change their life. But it really is those small little things, like you said, eating a little better, getting some exercise, getting out and getting a little bit more active certainly can help.
And you talked about knowing your numbers. I feel like that's something that a lot of us probably walking around having no idea where we're at. We're like, oh, I think we're fine. I mean, where's the best way to go get those numbers and, like, you know, make sure that you are doing okay, or maybe you do need a little work this upcoming year?
Well, certainly seeing your primary care physician is very helpful to get your blood checked and again, see what your cholesterol numbers are. I think it's not too challenging, maybe even to go into a pharmacy and get your blood pressure checked. But again, those numbers are so important because often we don't even know that there's anything wrong. We don't feel it when we have high blood pressure. We don't feel it when we have high cholesterol. So again, it's very important to just start with that baseline of understanding where you're at today.
Yeah, it's kind of a good thing to do right at the end of the year. Be like, okay, this is where I'm at. Maybe make a couple little changes, check in with your primary care, like you're saying, stop in the pharmacy, just these little things, and make it part of your New Year's New You resolution.
Exactly.
Kelly, thank you so much for stopping by so early and just reminding us, because it's important here as we're closing out the 2022. I have to keep thinking about it.